every day, maybe twice a day, but we rarely give it that deep thought. It feels simple, but it's often just marketing noise.
Exactly. And that's precisely why we wanted to do this deep dive. We want to cut through that noise. And thankfully, we have this amazing source you shared, a systematic review and a network meta-analysis of clinical trials. That sounds like the heavy artillery of evidence.
It really is. It's designed to synthesize a huge amount of research. And the good news is the answers it provides are actually, well, clearer than you might expect. It gives us a pretty solid shortcut to knowing what's what for our oral health.
Okay, fantastic. Let's get into it then. But maybe before we compare brush types, let's just quickly set the stage. Why is brushing our teeth so fundamental? What's the core problem we're actually tackling every morning and night?
Well, the main enemy here is dental plaque. It's that sticky film of bacteria that builds up on your teeth. And that plaque is the direct cause of gingivitis.
Gingivitis, that's the red swollen gums, maybe a bit of bleeding when you brush.
Exactly. The good news is gingivitis is reversible. You just need to reduce the plaque. But, and this is crucial, it's also a major risk factor, really a necessary first step for periodontitis.
And periodontitis is the more serious one, right? The one that can damage bone.
Precisely. It can damage the structures supporting your teeth, and ultimately you could lose teeth if it's not treated. So managing plaque effectively is the absolute primary way to prevent periodontitis.
Okay, so the stakes are actually quite high. Plaque isn't just cosmetic.
Not at all. And when it comes to removing that plaque, the toothbrush, even after all this time, is still seen as the most effective tool we have, our main line of defense.
Right. So if brushing is our weapon, the big question is, which weapon works best? For ages, it was just the manual toothbrush. Simple, everyone used it, super cheap, the classic.
It absolutely was. And look, it still does a job for many people. But then, back in the 1940s, we started seeing the first powered toothbrushes, the PTBs. Those early ones, well, they were basically just motorized manual brushes, sometimes not even as good as doing it by hand.
Huh, interesting. So they didn't exactly start strong, but obviously they've evolved a lot since then.
Oh, massively. Over the years, the designs have changed dramatically. We've seen better brush heads, different filament arrangements, much faster and more complex motions, plus features to help people brush better timers, pressure sensors.
Right, those little buzzes telling you to move to the next quadrant.
Exactly. And now even things like mobile apps that track your coverage and give you feedback in real time, all these things have boosted how well they remove plaque. And today, the two main players in the effective powered toothbrush market are the oscillating-rotating type, or OR, and the high-frequency sonic type, HFS.
Okay, OR and HFS. That brings us right to the core comparison. So you have the classic manual brush and then these two advanced powered types. Mechanically speaking, how do they actually work differently? What's the action?
Well, the oscillating-rotating, the OR brushes usually have these small, round heads. They spin back and forth very fast, sometimes with a pulsating motion too. Think of it as a kind of power scrubbing action, physically lifting the plaque off.
Okay, a scrubbing motion. And the sonic ones?
The high-frequency sonic, or HFS, they vibrate at incredibly high speeds. We're talking like 30,000, 40,000 strokes a minute, sometimes even more. This high frequency doesn't just rely on bristle contact. It creates these dynamic fluid forces in the saliva and toothpaste around the teeth. And those fluid forces can help dislodge plaque and debris even slightly beyond where the bristles reach, like just under the gum line or between teeth.
Wow, okay. So two quite different approaches to getting the job done. Now, you mentioned this study is a systematic review and network meta-analysis. I know that means it's looking at lots of studies, but why is that specific methodology, the network meta-analysis part, considered so powerful? What makes it the top of the evidence pyramid, as you said?
That's a really key point. So a standard meta-analysis pools data from studies that directly compare two things, say brush A versus brush B. A network meta-analysis, or NMA, goes a step further. It includes those direct comparisons, AVSB, but it also cleverly uses indirect evidence. Let's say one study compared AVSC and another compared to BVSC. The NMA can use C as a common link to estimate how A compares to B, even if they were never directly tested against each other in the same study.
Ah, I see. So it's like building a web of evidence, connecting all the dots, even if the direct lines aren't there.
Exactly. It weaves together all the available evidence, direct and indirect, into a single, coherent analysis. This gives you more precise estimates of how effective each option is, and importantly, it allows you to rank all the options against each other simultaneously.
That sounds incredibly thorough.
It is. And for this specific review, they looked at 28 different publications, which contained 56 relevant comparisons. All the data was gathered up to August 2021. So it's a really comprehensive snapshot of the research landscape.
Okay, the methodology is impressive. So let's get to the results. After crunching all that data, what did the NMA actually find? What should we be using?
Right. The bottom line. The first major finding was comparing powered toothbrushes, specifically the oscillating-rotating type, against manual toothbrushes. The NMA showed a clear, statistically significant difference. The OR power brush was better at removing plaque. The paper states there's high certainty for a small effect, favoring the powered brush over the manual one.
High certainty, that sounds definitive.
It strongly supports recommending a powered toothbrush for daily plaque control.
Okay, high certainty is great, but then there's that phrase small effect. When I hear small, I immediately think, well, how much does it really matter day to day? Is that small difference going to prevent a cavity or save my gums down the line?
That's such an important question. Small effect is a statistical term, and it doesn't mean unimportant in real life, especially over the long haul. Think of it like compound interest for your oral health.
Okay.
A small but consistent daily improvement in removing plaque adds up significantly over months and years. It's not about a miracle cure overnight. It's about lowering that bacterial load slightly but consistently every single day. And that accumulation of benefit can translate to fewer episodes of gingivitis, maybe avoiding some bleeding gums, and more importantly, lowering your long-term risk of developing periodontitis, or maybe even getting new cavities. So small effect short-term, potentially substantial cumulative impact long-term.
That's a much clearer picture. Like investing early, the small gains compound. So powered brushes, especially OR, get a strong recommendation over manual.
Got it. Now, what about the showdown between the two types of power brushes, the OR versus the HFS Sonic?
Yeah, they looked at that comparison too. Here, the analysis found there is moderate certainty for a very small benefit for using an OR brush compared to an HFS brush.
Moderate certainty, very small benefit.
And when they ranked all the brush types based purely on plaque removal efficacy in these studies, the OR-powered brush came out top, then the HFS-powered brush, and then the manual toothbrush came in last.
So the OR is technically the winner, even among the powered types, but very small benefit. That sounds even more subtle than the difference between powered and manual. Does that suggest that maybe for the average person, the difference between a good OR and a good HFS might not be that noticeable in their daily routine? I think that's a very fair takeaway. You're absolutely right. While the OR demonstrated that slight statistical edge in the analysis, the practical difference day to day might be negligible for many users. Both OR and HFS technologies are significantly better than manual brushing when used properly.
Right.
So yes, while the science gives OR a slight nod, perhaps the bigger message for someone choosing a powered brush is about consistency. Using either a quality OR or HFS brush correctly twice a day is probably far more important than agonizing over that very small difference between the two technologies.
It makes a lot of sense. Technique and just doing it consistently are key.
Absolutely. And, speaking of nuances, the researchers themselves brought up an interesting point about how plaque is measured in these studies.
Oh, yeah.
They mentioned different plaque indices, basically, different scoring systems used in the trials. Things like the Quigley and Hine Index or the Rastogi Modified Navy Plaque Index.
Different ways of scoring plaque. How does that work?
Yeah, they use slightly different criteria or scales to assess how much plaque is present and where. One index might be more sensitive to, say, thin layers of plaque, while another might focus more on thicker buildup or plaque near the gum line.
Huh.
While they all aim to quantify plaque, the specific index used in the study could subtly influence the exact percentage reduction reported. It doesn't change the overall direction of the findings, but it highlights the kind of methodological details these researchers consider. It's why meta-analyses are helpful, as they combine results across studies that might use slightly different measurement tools.
That level of detail is really something. It also makes me think about another detail. A lot of these studies you mentioned focus on a single brushing action, right? Like measuring plaque right after one cleaning under controlled conditions.
Yes, that's common in efficacy studies.
So how does that translate to us brushing twice a day, every day, for years and years? What does that single snapshot tell us about long-term health?
That's a critical point to consider. These single brushing studies are designed to assess the potential effectiveness of a toothbrush, sort of like testing its maximum power under ideal circumstances.
Like a lab test.
Exactly. They show what the brush can do. They don't directly measure, say, the reduction in gum disease over 5 years in a real-world population. However, the logic is pretty strong. If a brush consistently demonstrates a greater ability to remove plaque in these short-term tests, It's reasonable to infer that it will likely lead to better plaque control over the long term when used regularly. And better long-term plaque control is what's expected to deliver those real-world benefits: healthier gums, less inflammation, and ultimately a lower risk of cavities and periodontitis.
Okay, so it's a reasonable inference, but is there actual evidence confirming that? Studies that have followed people using powered versus manual brushes for years.
Yes, absolutely. And the source material does point to this. They mention recent longitudinal studies that track people over extended periods. For example, there was an 11-year prospective cohort study. That's a long time to follow people. And it found that people using powered toothbrushes did tend to keep more of their teeth and had significantly less progression of periodontal disease over that 11-year period compared to manual users.
11 years, okay, that's compelling.
It really is. It shows that the benefits seen in short-term studies do seem to translate into meaningful, measurable advantages for oral health over the long run in real life. It's not just theoretical.
That's fantastic to know. The long-term payoff is there. But let's talk practicality, because this is where it gets tricky for a lot of us. Powered toothbrushes, especially the good ones, cost more than manual brushes, sometimes a lot more. So, given the evidence, should absolutely everyone run out and buy one, even if the cost is a bit of a stretch?
That's the million-dollar question, isn't it? And it's where the concept of value-based oral health care, or VBOHC, comes in. The study touches on this.
Value-based oral health care. What does that mean exactly?
It means looking beyond just the upfront cost of the toothbrush. It encourages thinking about the total value delivered, which includes the health outcomes achieved for the money spent over time.
Okay.
So, yes, a power toothbrush costs more initially. But if it's significantly better at preventing cavities, and especially gum disease, it could potentially save you a lot of money down the road on fillings, crowns, deep cleanings, maybe even extractions or implants, which are incredibly expensive.
Ah, so it's an investment calculation, potentially. Paying more now might prevent much bigger dental bills later.
Exactly. Think about the cost of treating advanced gum disease, needing specialist periodontal care, or replacing a lost tooth. Those costs dwarf the price of even a high-end powered toothbrush.
Right, those procedures can run into thousands.
Precisely. So while the upfront cost is higher, the lifetime cost of maintaining your oral health might actually be lower with a more effective toothbrush, especially for people who are maybe more susceptible to dental problems. It makes the financial decision less about the sticker price today and more about a long-term individual calculation of potential benefits versus costs.
That's a really helpful way to frame it. It's not just about the brush, it's about the potential future dental work you might avoid.
That's the core idea of value-based care in this context.
Well, this has been incredibly illuminating. Let's try and sum up the key takeaways from this deep dive. The science, particularly this robust network meta-analysis, seems pretty clear.
Yeah, the main points are: powered toothbrushes overall show a clear advantage over manual ones for removing plaque. There's high certainty on that, even if the measured effect in short-term studies is statistically small.
And that small effect compounds over time for long-term benefits.
Exactly. And then, comparing the two main types of powered brushes, the oscillating-rotating ORR models showed a slight, statistically significant edge over the high-frequency sonic HFS models.
A very small benefit with moderate certainty.
Right, so ORR comes out technically on top, but consistent use and good technique with either type of quality powered brush are likely the most critical factors for the user.
It really underscores how being informed, even about something as routine as brushing your teeth, can lead to genuinely better health outcomes and smarter decisions, maybe even saving money in the long run.
Absolutely. It's a fundamental part of daily health we can actually optimize with good evidence.
It definitely makes you think, if there's this much solid science behind choosing the right toothbrush, well, what other everyday habits or choices in our lives might have some hidden science behind them? Things we could optimize based on evidence that could make a real difference to our well-being without us even realizing it. Something to ponder, perhaps, the next time you reach for your toothbrush.